So, what if there was this problem, like slowly, almost invisibly, eating away at the very heart of an industry, something that impacts livelihoods and animal welfare, but, you only see the damage when it's almost too late?
Yeah, it's a classic case of something insidious, you know,
Mm-hmm.
quietly spreading.
Mm.
And like you say, by the time you actually see the obvious signs, the damage is already, well, pretty extensive. It's not some dramatic fast thing, but this long, slow decline that can just devastate a herd.
It's exactly that kind of hidden threat we're diving into today, John's disease, and that's pronounced Johne's, also known as paratuberculosis. It often gets called an iceberg disease, and that metaphor is really, really key to understanding it.
Absolutely.
For every animal actually showing symptoms, they're just way more um, silently infected within the herd, just lurking there under the surface.
That analogy really nails the core problem, the bit you see. That's just the tip. There's this huge, unseen mass of infection underneath that can just ruin a herd before people even grasp the full scale of it, often until it's way too late.
So our mission today is to really get to grips with this. It's a chronic, contagious, and ultimately fatal bacterial infection. A massive concern for ruminants, like cattle all over the world. We want to unpack what it is, how it spreads so quietly, its huge impact, and crucially, what can actually be done about it. Let's pull back the curtain.
Okay, sounds good. So let's start with the basics. What is John's disease? Well, it's a chronic debilitating disease of the gut, the gastrointestinal tract. Primarily hits ruminants, and the big signs are progressive weight loss, just wasting away, and persistent diarrhea.
And the tiny culprit behind all this, it's a bacterium called Mycobacterium avium subspecies Paratuberculosis, MAP for short, thankfully.
Right, MAP.
It's slow growing, and here's a key detail. It's acid fast. Now, that characteristic is actually pretty important for how it survives and how labs try to spot it. But what's really interesting, I think, are its family connections.
Oh, definitely. MAP is actually a close relative of the bacteria that cause tuberculosis and leprosy.
What?
Yeah. So that gives you a clue about its nature, right? It's persistent. It likes to live inside cells.
Yeah.
It often triggers these walled-off infections. We call them granulomas. That's the body trying to contain it, but it just leads to this chronic inflammatory bowel disease.
And it really does stick around. This isn't just a local issue, is it? It's endemic. It's widespread globally. I mean, get this. A study back in 2008 in the U.S. showed that something like 68% of U.S. dairy herds had at least one positive cow.
68%. Yeah.
And in the really big operations, it was getting close to 100%. That's just huge.
It's incredibly pervasive.
Yeah.
And while we talk a lot about cattle, because they're major hosts, MAP affects a whole bunch of other ruminants, too. We're talking sheep, goats, water buffalo, llamas, alpacas.
Really?
Oh, yeah. Moose, reindeer, bison, too. And what's kind of surprising is it's even popped up in species you wouldn't expect, like rabbits, dogs, cats, horses, pigs, even some birds. It's remarkably adaptable stuff.
Okay, so an animal swallows this incredibly tough bacterium. What happens next? What's this sort of invisible invasion process look like inside the animal?
Right. So once it's ingested, the MAP bacteria, they kind of pass through the lining of the intestine. Then they get picked up by these specialized immune cells, macrophages, specifically in a place called the Peyer's patches in the avium. That's part of the small intestine. That's kind of its base camp.
So it's not just floating around, it's actively getting inside the animal's own immune cells. Sneaky.
Exactly. It gets inside and it survives and even multiplies within those very cells that are supposed to kill invaders. And this triggers that granulomatous inflammation we talked about, this chronic, smoldering, inflammatory bowel disease.
Yeah.
And here's the really bad part. This inflammation makes the intestinal walls get really thick.
Okay, so if the walls of the gut are thickening up, what does that actually do to the animal? Like functionally? What about absorbing nutrients?
That's the absolute crux of it. The core problem becomes severe malabsorption. That thickening just massively reduces the intestine's ability to soak up nutrients from food. And that's why you see that awful progressive weight loss. Even though the animal might still be eating really well, maybe even seems hungry all the time.
Oh, wow.
They're eating, but their body just can't use the fuel. They're essentially starving internally.
That just sounds incredibly cruel.
Yeah.
And debilitating. And then there's that really severe sign, bottle jaw. What does that tell us?
The bottle jaw. You see that in the advanced stages. Basically, so much protein is lost from the bloodstream into the gut that fluid starts building up under the jaw. It's edema. And seeing that, it's a critical sign. It really indicates the terminal phase of the disease.
So it's a sign things are very near the end.
Yeah. This progressive damage just leads inevitably to severe malnutrition, wasting away, emaciation, and eventually death. It's a really difficult, drawn-out end for the animal.
A slow, relentless decline. Okay, so if that's what's happening inside the animal, let's talk about the hidden highway. How does Johne's actually spread from animal to animal or maybe herd to herd?
Well, the number one route, the main highway, is fecal-oral. Animals swallow the bacteria, usually by eating contaminated feed, drinking contaminated water, or a big one for calves is drinking contaminated colostrum or milk from an infected mother.
You mentioned this bacterium is tough. Just how resilient is it out in the environment? Does that play a big role in spreading?
Oh, it's incredibly resilient. MAP can survive for up to a year, maybe even longer, in places like soil or manure,
Yeah.
and even longer in water, apparently. It doesn't really multiply out there, but it just survives. So think about manure in a pasture, or maybe slurry spread on fields or contaminated water troughs. They become these persistent reservoirs of infection. Environmental contamination is a huge factor.
And who's most likely to get infected? Is it any age or some more vulnerable?
Newborns and young animals are definitely the most susceptible, especially those under 6 months old, and really through their whole first year. They often get infected just by swallowing tiny amounts of manure, maybe from the calving area, maybe off the mother's udder when they're nursing,
Yeah.
right at the very start of life. That's why managing that early period is so critical.
So often infected right near birth, but you also mentioned it can pass from mother to offspring before birth, vertical transmission.
That's right. Intrauterine transmission, so infection across the placenta to the fetus, it can happen, especially if the mother is in the later stages of the disease herself. And then, yeah, as we said, direct transmission through the milk, and that first milk, the colostrum, is also a really significant route. So the young ones can get hit multiple ways.
And one of the trickiest parts, I gather, is the carrier problem. That seems like the real insidious threat when it comes to bringing this disease into a clean herd.
It really is. The most common way Johne's gets into a previously uninfected herd is by bringing in animals that are silently infected. These carriers, they look perfectly healthy, sometimes for years, but they're shedding the MAP bacteria, maybe intermittently, maybe constantly in later stages, into the environment. They're like secret agents, perfectly disguised, spreading infection without anyone realizing. It's a nightmare scenario for a producer.
So they just walk in, look totally fine, and start seeding the infection everywhere. Wow. Okay, so to help people focus their efforts, maybe we should quickly clarify what doesn't really spread it.
Yeah, that's a good point. Like just nose-to-nose contact over a fence. Probably not a big risk, unless manure somehow gets pushed under the fence. Things like sneezed aerosols or artificial insemination, even natural breeding, those aren't considered significant ways it spreads. The real focus has to stay on stopping that fecal-oral route and cleaning up contaminated environments.
Okay, so given how sneaky this is, what signs do we eventually see? And how does that Johne's iceberg idea fully play out with the actual symptoms and stages?
Right. Well, the first thing to remember is the incredibly long incubation period. It's typically, 2 to 6 years, sometimes even longer. So clinical signs, the stuff you can actually see, they rarely show up until years after that initial infection, which, remember, usually happened way back when they were a calf. This massive delay is exactly why it's so difficult to spot early.
And this is where that iceberg picture really comes into focus, right? The bits sticking out of the water, the sick animals, that's just a tiny fraction of the actual problem down below.
Exactly. We can kind of break it down into 4 stages, which really paints that iceberg picture.
This is the early, silent, totally undetectable infection. The animal looks perfectly healthy, shows zero signs, and you can't usually detect it with common tests. They're shedding very few, if any, bacteria. This is the massive, invisible base of the iceberg, completely hidden.
Okay, completely underground, basically. What's the next level up on this iceberg? Stage 2. Does it start to surface at all?
Stage 2 animals, we call them the subclinical shedders. Now, these animals still look healthy, generally, but crucially, they may be intermittently shedding MAP bacteria, usually in low numbers. Some might start testing positive on blood tests, like Elisa, but not all. So they're still largely hidden, but they are now definitely a source of infection for others. Maybe you'd see subtle things in a herd, like slightly lower milk production or slower growth rates, but nothing you'd immediately point to as Johne's disease.
Still pretty subtle, but they're actively spreading it now. Okay, and stage 3.
Stage 3 animals are kind of intermittent or early clinical shedders. Now, these guys might still look okay some of the time, or they might start showing signs that come and go, maybe bouts of diarrhea, maybe some weight loss, but not consistently. They're much more likely to test positive on fecal culture and blood tests now. And critically, they are often shedding high numbers of MAP bacteria, so they become a really significant risk for transmitting the disease to the rest of the herd.
Okay, this is where it's starting to become a really obvious, undeniable problem.
Yeah.
And then finally, we hit stage 4,
Yeah.
the visible tip of the iceberg, the really sick ones.
Yes, stage 4 is full-blown clinical Johne's disease, and these animals are heavy shedders. Now, you see those classic unmistakable signs that chronic, really profuse, watery diarrhea, often described as green, maybe bubbly, but typically without blood or mucus. You see that relentless weight loss, even though they might still be eating normally. And in dairy cows, a big drop in milk production. And then seeing that bottle jaw we mentioned earlier, that edema under the jaw, that signals the terminal stage. They probably only have weeks left at that point.
And after all those years of it hiding, what often makes those awful clinical signs suddenly appear? Is there usually some kind of trigger, a stressor?
Yeah, often symptoms become apparent, or much worse, after some kind of stressful event. Calving is a really common one, yes. It seems like the stress of calving, or maybe other stressors like changes in feed or environment, can be the final push for an animal whose immune system is already struggling, tipping them from that subclinical stage into obvious clinical disease.
Right, so with this disease being so good at hiding for so long, how on earth do you find it? What's the diagnostic challenge here?
Yeah, the diagnosis is definitely one of the biggest hurdles, precisely because of that super long incubation period and that whole iceberg thing.
Yeah.
Finding it early is tough. It really takes persistence and usually a combination of approaches.
What tools do we actually have? Is there like a gold standard test? And what are the catches?
Well, for live animals, doing a fecal culture trying to grow the MAP bacteria from a manure sample, that's generally considered the gold standard. Because if you grow it, you know it's there and it's alive. But, and this is a huge but, MAP is incredibly slow growing in the lab.
Ah,
It can take anywhere from 5 weeks up to 6 months to get a result on traditional solid media. Liquid culture methods are faster, maybe 8 to 12 weeks sometimes, but still, it's not quick. That's a really long time to wait if you suspect you have a problem and need to act fast.
wow, 6 months. That's ages. Are there any faster ways to check?
Yeah, thankfully. Fecal PCR is much faster. PCR looks for the MAP DNA directly in the feces, so you're not waiting for it to grow. It's really useful for getting a rapid detection, especially if you have an animal showing clinical signs. Then you've also got serology, blood tests like the ELISA test. These look for antibodies the animal has made against MAP. They're generally better for screening whole herds rather than diagnosing individual animals, especially in the early stages, because the ability to pick up infected animals can be a bit variable. Not all infected animals will test positive, particularly early on.
And then I suppose the ultimate confirmation can come after an animal has died or been culled.
Yes, definitely. A post-mortem examination is really the definitive way to confirm it. You can take tissue samples, biopsies from the affected parts of the intestine, like the ileum and nearby lymph nodes.
Yeah.
Under the microscope, you can see the characteristic damage, the lesions, and often the acid-fast bacteria themselves within the tissues. That gives you a solid, undeniable diagnosis.
Okay, so given all of that, the silent spread, the long wait, the tricky diagnosis, what's the sort of unforgiving reality when it comes to treatment, control, and prevention for Johne's?
Well, the unforgiving reality is pretty stark. There is currently no effective treatment or cure available for Johne's disease in an individual animal. Once an animal starts showing those clinical signs, it's generally considered best practice to cull it from the herd to stop it from shedding massive amounts of bacteria and infecting others.
So no fixing the sick ones.
No. And that fact completely shifts the focus, doesn't it? You can't treat your way out of this. The entire effort has to be poured into prevention and control at the herd level. It's about building defenses, comprehensive management, and biosecurity. It's really a fortress mentality.
Building a fortress. So what does that involve? How do you prevent it getting in or manage it if it's already there?
Exactly. So number one is trying to prevent introduction in the first place. The ideal scenario is a closed herd. You don't bring any new animals in, but that's not always practical. So if you do buy animals, you have to be incredibly careful. Source them from herds that are known to be test negative or have a certified low-risk status for Johne's. And even then, it's wise to test any new animals before they join the main herd. Remember those silent carriers? They're the biggest risk for bringing it in.
And protecting those young animals seems absolutely vital given how susceptible they are. What are the key things there?
Oh, absolutely critical. Protecting the calves is probably the single most important thing you can do. This means super clean birthing areas, physically separating young calves and heifers from the adult cows and their manure, completely separate housing and pastures if possible, using dedicated feeding equipment and manure handling tools just for the young stock, making sure they have clean water sources, not contaminated by adult manure runoff. These aren't just suggestions, they're really essential foundations for control.
And what about that colostrum and milk route? That first milk is so important, but it sounds like a potential danger zone too.
Huge potential danger zone. The ideal is to feed colostrum only from cows you know are test negative for Johne's, and absolutely never pool colostrum from multiple cows because if just one of them is infected, you could spread it to every calf fed from that batch.
Ah, okay. Don't pool it.
Right. Same goes for feeding raw milk later on. Avoid pooling milk. Keep udders clean when collecting colostrum. Many experts recommend feeding a high-quality artificial milk replacer instead of raw milk. Or if you use real milk, make sure it's pasteurized properly. And definitely never feed pooled waste milk or discard milk to calves, as that's potentially loaded with bacteria if it came from infected or treated cows.
It sounds like a constant, vigilant effort on so many fronts.
It really is. It's a long-term commitment. Good manure management is also key. Remember how long MAP survives out there? So proper storage, careful spreading, keeping it away from feed and water sources, and then, yeah, prompt action when you do find infected animals. Culling, or at least completely separating all test-positive animals, especially those showing signs and their offspring, is vital to reduce the amount of bacteria being shed into the environment.
What about spreading between different species? You mentioned sheep, goats, etc. Is that a big concern?
It can be. While transmission between different species isn't maybe the main driver, it definitely happens. So, for instance, avoiding co-grazing sheep and cattle on the same pasture is often recommended, as sheep can carry and shed MAP too. And a practical tip. Beef producers should be extra cautious if buying animals from dairy herds, just because the prevalence of Johne's tends to be significantly higher in dairy cattle compared to beef cattle generally.
I think I've heard about vaccines being used in some countries, but you don't see them much here in the U.S., right? How well do they work?
That's correct. Vaccines are available and used in some parts of the world, but not currently licensed in the U.S. for cattle. Where they are used, they can help. They tend to reduce the severity of the clinical signs if an animal does get sick, and they can reduce the amount of bacteria the animal sheds. But, and this is important, they do not prevent infection entirely, nor do they eliminate it. The animal is still infected.
So it helps manage, but doesn't cure or prevent.
Right. And another significant issue is that the current vaccines can interfere with the tests used for bovine tuberculosis, TB surveillance. Since TB control is a major public health program, that interference is a big obstacle to vaccine use in many places, including the U.S.
Okay. Are there programs or resources to help producers who are trying to deal with this really complex problem?
Yes, definitely. The USDA provides guidance and resources, and many individual states have voluntary Johne's disease control programs. These programs often work with vets and producers to develop herd management plans, testing strategies, and help them work towards controlling the disease and maybe achieving a lower risk status for their herd. It's very much an ongoing collaborative effort between industry, vets, and government agencies.
It certainly sounds like a massive challenge, not just for the animals themselves, but for the whole economics of farming. What's the real impact there? Economically, and think about animal welfare too.
Oh, the economic hit is substantial, and it's often underestimated precisely because of that hidden iceberg nature. You've got reduced milk production, often happening before you even see any other signs, so that's lost income right there.
Hidden losses.
Exactly. Then there's early culling. Animals get sick or unproductive younger than they should, so you lose years of potential productivity and have higher replacement costs. When animals are culled because of Johne's, they're often in really poor body condition, so their salvage value, what you get for them at market, is much lower. And then add on top all the costs of trying to control it. The testing, the extra labor for segregation, improved sanitation, different calf rearing systems, it all adds up significantly. The full economic burden is almost always heavier than it first appears.
And turning to the animal welfare side.
Right.
I mean, based on everything you've described, it sounds truly awful for the animal.
It really is. From a welfare perspective, it's deeply concerning. Remember, this is a chronic inflammatory bowel disease. That means potentially years of internal discomfort and inflammation before any outward signs are obvious. Then comes that relentless decline, the progressive weight loss, the weakness, even while they still want to eat. It's a slow wasting process. The chronic diarrhea itself causes issues, dehydration, further nutrient loss, problems with hygiene, skin irritation, and seeing that bottle jaw develop, it's a visible marker of severe internal protein loss and signifies that death is imminent. Ultimately, the disease leads to severe malnutrition, profound debilitation, and death. It's a very difficult, protracted way for an animal to suffer.
Just devastating for the animals caught up in it and clearly a huge burden for the industry. But what about us? Is there any human connection here? Any public health aspect we should be aware of?
Right, this is an important point and one that often comes up. There has been research interest and some ongoing debate about a potential link between MAP, the Johne's bacterium, and Crohn's disease in humans. Crohn's is also a chronic inflammatory bowel disease, and it shares some similarities with Johne's disease in animals. And MAP has, on occasion, been detected in tissues or blood from some patients with Crohn's disease.
Okay, so MAP has been found sometimes in people with Crohn's. But what does the science actually say about whether MAP causes Crohn's?
That's the absolutely crucial distinction. It's really important to stress that at this point in time, there is no conclusive scientific evidence proving that MAP itself is a direct cause of Crohn's disease in humans, or that Johne's disease is a zoonosis, meaning a disease that jumps directly from animals to cause illness in people. Finding the bacteria in some patients doesn't automatically mean it caused the disease. The research is still ongoing, scientists are still investigating this potential association, but right now a direct causal link has not been established. It remains an area of active scientific inquiry, not a confirmed public health risk.
Okay, that's a really important clarification. So wrapping this up, what should we, the listeners, take away from all this? We've seen Johne's as this chronic, incredibly sneaky disease spreading silently, essentially untreatable once it becomes obvious, which makes that proactive prevention and management absolutely critical.
I think this deep dive into Johne's really serves as the powerful reminder, doesn't it? It shows how these unseen challenges, these iceberg diseases, can have truly profound impacts. Impacts on entire industries, certainly on animal well-being, and they can even raise these complex questions that touch on human health. It underscores the need for constant vigilance, for really rigorous management practices, and just a commitment to staying informed and proactive.
Yeah, absolutely. It kind of leaves you wondering, doesn't it? What other icebergs, what other hidden challenges might be lurking out there in areas we just take for granted, just waiting for us to take a closer look and gain a deeper understanding? Definitely something to mull over.